Osteopath, and today I want to explain to you 2 simple mainstay exercises for the low back, safe for almost everyone with the exception of maybe those with an acute herniated disc and referred pain into one or both legs. These are mainstay exercises that you can do all the time for back maintenance, not only to get out of trouble but stay out of trouble. The ones that I would turn to myself almost every day to decompress the spine, take pressure off nerves and oil the facet joints and allow the discs in the low back, the lumbar spine, that's the bottom 5, to rehydrate. Okay, so the first one is one called knees to chest. Okay, this is a misnomer because you're not bringing the knees all the way to the chest, you're bringing them just some of the way to the chest. Let me explain. Okay, so your spine is not flat, it's got neutral curves, so it's got a lordosis here, which means an arch, an inward concave arch. The thoracic has got a little bit of a convexity, and your neck, then your C-spine, has got a little bit of a concavity or lordosis. So lordosis, kyphosis, lordosis. When people get, so this exercise will help a number of ailments. One being a herniated disc. Herniated discs typically occur in people between the ages of 30 and 50, believe it or not. When the disc is nice and ripe and well hydrated, it's more inclined to herniate. Older people generally tend to get more osteoarthritic, facet joint hypertrophy, stenosis, kind of wear and tear stuff. But younger people and older people can also get herniated discs. When you get a herniated disc, generally, almost all the time, it will herniate or bulge posterior, and more often than not posterior lateral, to the back and to the side. So on the spine here, it will bulge in here, which is approximately where the nerve root is, unfortunately. What causes a herniated disc? Chemical breakdown of a disc, improper lifting, improper posture. Generally the opposite to hip hinging, which is this. I'm keeping a neutral spine, I'm both bending the knees, but the piece everyone forgets is to keep the spine in neutral. Most people bend the knees and curve the spine. This puts the spine in a very awkward position because it puts compression on the anterior, the front portion of the spine, and squeezes the nucleus or the disc material, or compresses it or puts pressure on it to force it posterior and lateral. Not unlike squeezing toothpaste out of a tube. So over time, incorrect lifting, poor posture, sitting, brushing your teeth, washing your face, shaving, whatever you're doing, all of those positions can push the hydrophilic, the water-based nucleus through fissures and cracks like a maze, and eventually it will work its way out and it may hit a nerve whilst doing something mundane like picking up your shoes or socks. Okay, so what we want to do to mitigate against this is to open the spine by pulling the knees toward the chest and opening the intervertebral disc space just enough to allow a herniated disc to rehydrate, which is like taking pressure off a tube of toothpaste and allowing the toothpaste to move back into the tube. If you push it out completely, you can't get it back in, but if it's just poking out a little bit, taking pressure off it without loading it, which is what we're going to do, will allow it to rehydrate. Also, the exit foramina, the holes where the nerves pop out, are a fixed size, but because they're made up of an articular surface on the vertebrae above and below at the facet joint, when you bring the knees toward the chest, it becomes less of a circle and more of an ellipse. So it widens, so it can take pressure off the nerve. Okay, and also you're oiling the joints. By moving the joints, they're constantly closed. These joints generally won't open for most people during a day, because even when they're bending, they're opening from the top down. So from your neck, your thoracic spine, and by the time you get down here, you're taking the entire weight of your head and your upper body, and all you've got down here is stress, and it's still not open. So what we were going to do is we're going to lie down, we're going to hold our knees, draw the knees until the arch in the low back, the hollow in the low back, is flat into the couch in this case, or the floor if you're doing it at home, and that's far enough. And now you have liberated the facet joints, you've opened them enough to allow them to rehydrate, you've widened the exit foramina, so you've taken pressure off the nerves, you have allowed fluid around the facet joints, and you're going to hold it for 5 seconds and bring it back to the start for 5, and you're going to repeat that 10 times, and you'll do that daily. So let me demonstrate that for you. So you lie down on the floor, you'll start like this, your hands on the knees like this, and your arms straight, your head supported on a pillow or 2 pillows if you like. You're going to pull your knees gently towards your shoulders, and you're going to stop as soon as your bum leaves the couch, and the main thing you're looking for here is your low back. The arch in your low back is now pressing into the floor. And that's far enough. Where this becomes a bad exercise is where people begin to hug the knees and rock back and forward. And someone with a herniated disc, that will more than likely worsen it, because it will push, as I said, the toothpaste out of the tube, okay? And aggravate a herniated disc and press the nerve root. So up for 5, down for 5. Up like that, 1, 2, 3, 4, 5. Down for 5. And you'll do that 10 repetitions of that. You'll do that morning and night, okay? Most people, I don't say 3 times a day because they can't probably lie down and work on the floor and do it. If you do that morning, either when you wake up or after your shower and before bed, it'll go a long way to helping your low back. This is also very helpful for someone with like facet joint hypertrophy, which is when the facet joints, which are the joints I showed you on the spine there, they're the joints that aren't supposed to bear much load. The discs are designed to bear load. The facet joints are designed to facilitate movement and slide over each other. But as the discs desiccate or lose water and get thinner with wear and tear, the facet joints start to bear weight, they start to rub, and you get osteoarthritis or spondylitic change. The facet joints get roughened, misshapen, they start to encroach upon the nerve space, and then all of a sudden you can have nerve pain. What this is good for is those facet joints which are now load bearing and stiff and stuck and rubbing all day. When you do this exercise, you lift the facet joints off each other so you keep them oiled. And with arthritis, a joint that doesn't move well will seize up. So it'll every morning, every night, or 3 times a day if you have the time to do that and you're retired, it will help mobilize the spine. So it will take pressure off it. And generally it feels nice. And with the caveat that any exercise that I'm advising here, if it hurts to do it, either back off and decrease the range. And if that's still sore, don't do it. It's not meant to be sore. You don't push through it. It's meant to feel nice. It's meant to take pressure off the facet joints and open up the intervertebral disc space. Okay, so that's knees to chest, or knees halfway to chest. The next exercise is a knee crossover. And a lot of people, the glutes get very tight because of maybe sensory aggravation of some of the nerves in the low back. And also the SI joints can get very stiff. And the SI joints are the sacroiliac joints. The sacroiliac joints are these joints here. So the joint here between your sacrum, which is like the triangular keystone in the base of your spine, and your ilium or your nominate bones. That's what they look like from the front. That's where they are on the posterior aspect. Those joints are synovial joints, synovial cartilaginous joints, but they will, in ambulation when you're walking, they'll rock slightly. They do move, obviously, otherwise you'd be walking like this. And they are an area of dysfunction. So those who are sedentary, don't walk, don't move, these can tend to get very stiff. The sacrum is interesting. Sacroiliac joints are interesting because they have both form closure and force closure. Form closure is like how they sit into the ilium. So it's like the keystone in a Roman arch. That makes it sit in, and it can bear the whole weight of my head and upper body and sit in comfortably. And then you've got force closure, which is the ligamentous tissue around which joins the innominate to the sacrum, and the muscles that join, and the fascia that joins it all together and keeps it nice and tight. Now sometimes these can get overly tight, compress the SI joint, cause excessive wear. You can get inflammation in the sacroiliac joint like sacroiliitis, or just general soreness or dysfunction in the sacroiliac joint. So we want to keep these muscles a little bit loose, and we want to maybe pry them open a little bit to allow synovial fluid to circulate within the joint. So how do we do this? This one we call the knee crossover. So what I want to do with this one, I'll demonstrate this again. I lie down here like that. I'll bring the knee to 90 degrees, opposite hand, opposite knee. And what I'll do is I'll pull the knee across, not at 90 degrees like that, because what happens here is my whole spine rotates. Not necessarily a bad thing always, but it's not my objective here. And not straight up, that's too much flexion in this case. And I don't want to squirt the toothpaste out of the tube, and it's not my objective. My objective is to stretch the gluteal muscles and to open up the SI joint a little bit. So I'll bring it at 45 degrees, so I'm pulling this knee to this elbow or bicep this way. And my pelvis then acts as a fulcrum. so my body doesn't rotate. All I feel is a stretch here on the glute. So again, I'll breathe while I'm stretching. I don't hold my breath and count. Works better when you breathe. So draw to the barrier. Hold. Breathe. Bring to the barrier. And as I tend to do most of my stretches, I'll do 3 deep breaths, and each time drawing a little bit farther. This stretch is really good. The one reason, a word of caution I would give is if you feel a pinch in the groin, it could be pathology in the groin. That could be a hip impingement, like a femoral acetabular impingement, or it could be osteoarthritis in the hip. I'm not asking you to stretch through that pain. What you can do if you feel a slight pinch is drop the leg a little bit so it's more this way. We'll sacrifice and allow a little bit of rotation in the low spine and still get a stretch. If that's still sore, this exercise is perhaps not for you. It might cause more inflammation or irritation in the hip joint. But for most people, it's okay. So those are 2 great exercises. With this one, what I would do this 5 times each side. So I would go left, right, that's how it looks like from here. And 5 times each side. I would do those 2 exercises together, both morning and night. And if you're tired and you have the time, do it 3 times a day. They're not severe. They're not hard. You won't be out of breath, and you're not wrestling with your knees or pulling anything. They're nice and gentle exercises. It's just a way of staying mobile. So if you found those exercises useful, I would advise you to integrate them into your daily life. If you like the channel and want more content, just hit the like button. Please subscribe, and I'll talk to you next time. Thank you.